Their explanation is that when you eat certain foods, your uric acid's going to go up, and when the uric acid goes up, it's going to diffuse into the joints. I mean, this is the law of thermodynamics, actually, and I'm not arguing about that. It's true. The uric acid in the circulatory system is going to diffuse into other organs, and it's going to diffuse into the joints. Their argument is once it's in the joint, if the concentration of uric acid is high enough, then it's going to crystallize. And the crystallization, like having a splinter in your finger, is going to activate the immune system, and there will be a gout flare in response to the crystallized uric acid. That narrative is false. We've got something around somewhere between 68 to 43 million, somewhere in that range, of people walking around solely in the US that are hyperuricemic and not expressing gout, not having gout flares. So that's the first clue, that the fact that you can have high uric acid and not have a gout flare. And then when you look at what the mean concentration of uric acid is in a person who's having gout, it literally is approximately 8.3 mg per deciliter, which I know we're getting a little technical here, but that's the top of the reference range. It's not outside it. And when you talk to a doctor about this stuff, which I did in 2016, they're like, well, your uric acid is high and that's why you're having a gout attack. And when you look at my medical records, my uric acid in the clinic that day was, because they did the blood analysis right there, was 8.1 mg per deciliter. I literally was at the top of the reference range. I was not outside it. And then furthermore, there's two other issues here. A full 18% of gout sufferers have uric acid levels that are between 6 and 8 inside the range. And then there's a full 14% of sufferers who have uric acid concentrations that are under 6, which by any argument is well within what the establishment considers the normal range. But I've had 2 gout flares since going onto the ketogenic diet. One of them was in the beginning, and I know the questions that you sent me were going to address that issue. But when you go onto a ketogenic diet, and this is going to include carnivore, like if someone goes carnivore, today they're on the standard American diet, tomorrow they start carnivore, they're going to see an acute rise in uric acid in the circulatory system. And the reason for that is because they're producing very rapidly, they're going to be producing ketones, and acetoacetate and beta hydroxybutyrate. Both of those are organic acids, and they're preferentially excreted by the kidneys relative to uric acid. So what that does is it backs the uric acid up because it can't get out by excretion. And you see this rise. And it's during that rise that gout sufferers can be vulnerable to a gout flare when they're doing this transition onto a ketogenic type of lifestyle. Now, over time, what happens is that with all of the profound changes that are going on, the uric acid is eventually going to start to come down. But it was during that acute rise, I think I was at month 4, where I had a gout flare. It's important to mention that because I was on a ketogenic diet, and I believe because of the high beta hydroxybutyrate, which has been shown in the literature to inhibit the gout flare inflammatory process, that the flare was mild. I did make the choice to go on allopurinol, and the reason for that was 3 years into this, literally, and I have extensive data on myself because I finger stick for uric acid every single day before and after meals, and I've been doing that for a really long time. And one of the things the doctors will tell you is when you go on allopurinol, you're also vulnerable to a gout flare, and I had one. And here's the thing that is amazing. My uric acid concentration was 4.5 mg per deciliter. It's exactly in the range. If you talk to Dr. Johnson about this and you say, well, you know, after somebody is stabilized, right, they've eliminated alcohol and fructose and hyperglycemia, and they're no longer having gout flares. If they still are hyperuricemic and they take an urate lowering drug, what's the target? And he's going to say between 4 and 5 mg per deciliter. So, albeit when you go on the drug, you are vulnerable to a flare, and I had one. The interesting thing is that just like the first flare that I described to you, the symptoms were mild, and I didn't have to take even ibuprofen, and I didn't stop exercising. This seems to be a benefit to being on a ketogenic lifestyle, whether it's carnivore or whether you've ramped up the hill from that and you're eating, low carb vegetables as a function of your lifestyle or not, that if you do have a gout flare, that it tends to be mild. And this is what I hear from my followers too. I'm not claiming that this is any way of a scientific study, but the majority of them say up front, well, yeah, I'm still having some flares, but they're nothing like what I had before. So the first thing that gout sufferers got to understand is that gout is not an individualized specific type of ailment. And this is something that the medical establishment wants you to believe. It's like an inconvenient thing. You take an anti-inflammatory and it goes away. It's not. We know that uric acid is required for a gout flare, but here's the distinction. What's required for the gout flare is a sudden acute rise in intracellular uric acid in a chondrocyte, which is the biological cell that's important inside the cartilage. And that sudden acute rise of uric acid needs to be happening inside a chondrocyte, which is suffering from chronic low-grade inflammation. So I believe that the chondrocytes are primed for this. How do they get primed for it? Because people like me, for example, I'm in my 60s and I was eating the standard American diet for decades, and which is hyperglycemic. And then as an adult, I was drinking alcohol on a regular basis along with the added sugars. So you have what's called, I call it the deadly triad. You have the alcohol, you have the fructose that's coming in from the added sugars, high fructose corn syrups, and you have hyperglycemia.